Welcome to Medical Dialogues, your daily dose of health and medical news. I'm Roshni Dhar. Let's look at today's top headlines. A doctor and two children were killed after fire breaks out at a clinic in Andhra Pradesh. A doctor and his two children died in a fire accident that took place in Tamil Nadu's Tirupati district on Sunday. An initial investigation into the matter has revealed that the fire might have been caused by a short circuit. ncdrc relief to Apollo Hospital doctors on charges of negligence while treating cancer patient. The National Consumer Disputes Judicial Commission recently exonerated two doctors of Apollo Hospital, Kolkata, from charges of medical negligence while attending a patient who was undergoing chemotherapy treatment for metastatic ovarian cancer and died inside ICU. Although the husband of the deceased patient had demanded a token compensation against alleged negligence and technical lapses on the part of the doctors, the top consumer court relied on the opinions expressed by WBMC, the expert medical board, and the Supreme Court order and exonerated the doctors. Implement Digi Locker NAD facility and ncdrc all medical colleges. Taking another step towards digitalization of medical education in India, the National Medical Commission has recently directed all the medical colleges to upload their 10 years academic certificate data through Digi Locker National Academic Depository. In this regard, the Apex Medical Commission referred to a notice issued by the President and the Chief Executive Officer of National E-Governance Division, Shri Abhishek Singh, who had earlier implementation of Digi Locker facility in the educational institutes. 6 new medical colleges in PPP model to come up in Uttar Pradesh. The Uttar Pradesh government, in a press statement on Thursday, stated that 6 new medical colleges would be coming up in the state based on a public-private partnership model. The state mentioned the places where the colleges are slated to come up with is Mahoba, Mainpuri, Bhagpat, Hamirpur, Hathras and Kasganj, and it added that the investors for these colleges would be decided very soon. That's all from the health world. Now we have Isra Zaman to update us about the happenings in the medical world.
I'm Mr. Zaman and here's what I bring to you all from the world of medicine. COVID-19 linked to a 72% increased diagnosis of type 1 diabetes in youth. Children who were infected with COVID-19 show a substantially higher risk of developing type 1 diabetes or T1D, according to a new study that analyzed electronic health records of more than 1 million patients aged 18 and younger. The findings showed a 72% increase in new diagnosis of type 1 diabetes in COVID-19 patients. Although the research emphasized that it is unclear whether COVID-19 triggers new onset of type 1 diabetes. About 187,000 children and adolescents younger than 20 live with T1D nationally, according to the Centers for Disease Control and Prevention. Reusable contact lenses more than triple risk of rare preventable eye infection. People who wear reusable contact lenses are nearly 4 times as likely as those wearing daily disposables to develop a rare sight-threatening eye infection, finds a study led by UCL and Moorfields researchers. Contact lens use is now the leading cause of microbial keratitis in patients with otherwise healthy eyes in countries in the global north. Sight loss resulting from microbial keratitis is uncommon, but acanthamoeba, although a rare cause, is one of the most severe and is responsible for about half of those contact lens users who develop sight loss after keratitis. 90% of acanthamoeba keratitis or AK cases are associated with avoidable risks, although the infection remains rare, affecting fewer than 1 in 20,000 contact lens wearers per year in the UK. Link between early in life air pollution exposure and changes in brain structure. A study published in the journal Environmental Pollution has found an association in children aged 9 to 12 between exposure to air pollutants in the womb and during the first 8.5 years of life and alterations in white matter structural connectivity in the brain. Tracts or bundles of cerebral white matter ensure structural connectivity by interconnecting the different areas of the brain. Connectivity can be measured by studying the microstructure of this white matter, a marker of typical brain development. Abnormal white matter microstructure has been associated with psychiatric disorders. That's all from the medical world. Now we have Dr. Nandita Mohan to update us from the medical journals.
Hello and welcome to Medical Dialogues Journal Club. I am Dr. Nandita Mohan and today I am going to discuss about a new trial that was recently published in the Indian Heart Journal, that is the IMPROVE Brady study. This study basically assessed whether a process improvement intervention could increase the adoption of guideline-based therapy in sinus node dysfunction patients. Now, sick sinus syndrome is a rare type of heart rhythm disorder. It affects the heart's natural pacemaker, which actually controls the heartbeat. Now, sick sinus syndrome, it causes slower heartbeats, pauses, or irregular heartbeats and is relatively very uncommon. So the study that I'm going to talk about today is about a sequential prospective quality improvement initiative that was conducted in India and Bangladesh, where the patients with symptomatic bradycardia were enrolled. Now, in phase 1 of this study, physicians assessed and treated patients per standard care, while phase 2 was conducted after implementing educational materials for physicians and patients. The primary objects were to evaluate the impact of the intervention on the sinus node dysfunction diagnosis as well as the pacemaker implant. So in this study, a total of 978 patients were enrolled, that is around 508 in phase 1 and 470 in the phase 2. The results of the study highlighted that the diagnosis of sinus node dysfunction as well as the implantation of pacemaker both significantly increased from phase 1 to phase 2. The pacemaker implantation was not feasible in 41% of the patients due to either insurance or cost barriers. While both patient quality of life as well as the caregiver burden, it improved at 6 months post pacemaker implant. Hence, it was concluded that a process improvement initiative conducted at centers across India and Bangladesh significantly increased the diagnosis of sinus node dysfunction and subsequent treatment with pacemaker therapy despite the socio-economic constraints. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.